Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to do a quick mind map of venous leg ulcers. So venous leg ulcers are caused by insufficient veins in the legs. They're not bringing the blood back to the heart as it should. So that blood just sits in the bottom of the legs. It increases pressure, and then the increase of fluid starts causing these ulcers to form. We have valves legs, okay? So the veins, they're supposed to close like this. And as our muscles contract, the blood moves up the legs. Now, with people with an insufficient venous system, these valves stay open, okay? So the blood's not able to move up the leg as it should. So how do we diagnose venous leg ulcers? So normally the doctor or wound care specialist will just look at the legs, examine the legs, and there's a lot of telltale signs that we can see, but we'll look at that a little bit later under symptoms. But we can also do a Doppler and ABPI, so it's an ankle brachial pulse index. Now, what we determine through this is whether it is a venous issue or an arterial issue, and that's what we get through the numbers through the ABPI, and it's really just applying pressure using a blood pressure cuff to the legs and using a Doppler. So what is the cause or relating factors? So what's really going to cause venous leg ulcers? So obesity, deep vein thrombosis, varicose veins, previous injury to the leg, and age can all be relating factors. Now, what are the symptoms that we are going to see with venous leg ulcers? So they'll have swelling or edema in their leg. They could have discolored or darkened skin. Their legs may feel heavy. You may notice that they are dry, flaky, scaly, itchy, and the ulcers will be irregular shaped, okay? So they are not symmetrical and they are very irregular. They're very surface. So it just looks like the top layer of tissue is removed from the skin. Okay, so that's really the determining factor where you can really see the difference between venous and arterial. So venous is very irregular shaped and there's not a lot of depth. Now, how do we treat venous leg ulcers? So we need to debride. Is there any non-viable tissue that needs to be removed? Now, the patient doesn't do that. A wound care specialist or doctor specializing in wound care does need to do that debridement. We're going to apply a non-stick dressing at least 3 times per week. Now, this is going to be determined by how much exudate is coming out of the wound. If we have a high exudating wound, which we normally have at the beginning when we first start doing wound care for venous leg ulcers, especially when we're removing the fluid from the legs using compressions, we'll have a lot of fluid coming out, a lot of exudate coming out of that wound. So we may need to change the dressing more frequently until we have the legs slimmer and not so much edema. Now, compressions. I spoke about compressions. First, we want to make sure that we have done the ABPI and compressions, that we can actually use compressions, because sometimes we have mixed etiology. So that means they have venous and arterial disease. So we want to make sure that we're not doing any harm and they can wear compressions. Once that's been determined, compressions are for life. Okay, it's a preventative measure for venous leg ulcers, but it's actually going to allow us to heal the venous leg ulcers. So once we have the fluid removed, the fluid and the pressure is what caused the ulcer. So we have to remove that fluid and pressure to actually heal it. And then we wear them for life to prevent further complications and further ulceration. We then want to hydrate any dry or itchy skin that they may have using an appropriate hydrant for the leg. So that was our quick mind map of venous leg ulcers. Now you can see I didn't go into detail of specific dressing. Now every dressing is going to be different depending on the patient themselves. Why do I say this? Because it's going to be determined by moisture management. So it's going to completely depend on how much exudate is coming from that wound, or whether or not we have infection. Is it local or deep spreading infection? That's what's going to determine what we're using on a wound. Okay. That's pretty easy, and people can get quite caught up in, okay, what am I going to put on this wound? As long as we're providing moisture management, do we need to add moisture? Do we need to take away moisture? Do we need to have something to correct infection? So an antimicrobial or antibiotic. As long as we are doing the treatment methods, putting on compressions, we have to go back to our preventative measures. Okay. If we're removing the fluid and removing that pressure, the wound will heal. Okay. As long as we have moisture management, and if there's infection, to be using an antimicrobial or antibiotic if that's needed, that's what we need to do. The main thing with venous leg ulcers is removing that fluid and pressure. Okay. Without removing the fluid and pressure, we will not have a healable wound. The wound will not heal. Okay. That wound will not heal. So that is the main takeaway point out of this that I want you to get, is that we have to remove the fluid and that pressure on the legs, and that will let that wound heal. Okay, guys. So that's all I have for this video. I hope you did find it helpful, and I hope to catch you in my next one. Bye for now.